Dun 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 dun! Evolving therapies, the need for and use of
Microbubbles! Microbubble therapy is a form of treatment that allows for the specific targeting of organs like the heart in instances of disease such as coronary heart disease-induced myocardial infarctions.
But wait, what is peptide therapy, and how exactly does it work?
Peptide therapy is a technique used to treat specific diseases that affect the expression of proteins in the body. In many illnesses, proteins are either up or down regulated as a result of changed gene expression, and this causes many of the symptoms associated with the disease. With protein therapy, doctors are able to systemically administer specific protein isoforms that either counter this change in gene expression or act to fight the disease's symptoms directly. Peptide Man!
That makes a lot of sense. One of the main problems scientists faced when working with this novel technique was directing the proteins to specific sites within the body. The human body contains many conserved pathways that use the same proteins and hormones to elicit drastically different responses, all depending on where these molecules are interacting. Based on the route of administration, while you may see beneficial effects in the target tissue, would you not see negative effects elsewhere in the body where this peptide is not required in an altered concentration?
You're absolutely right. Increases of a peptide in other non-target tissues may cause deleterious effects. The solution to this problem came in the form of microbubbles, microscopic bubbles of drug-infused goodness that could be systemically administered and then localized wherever they were needed. Researchers created a microsphere consisting of an internal gaseous pocket of fluorocarbon gas, a middle layer consisting of an oily substance in which the therapeutic peptide is dissolved, and an external membranous layer composed of phospholipids, surfactants, albumin, and targeting molecules. But wait, how do they pop the bubbles once they're inside the body?
Well, researchers realized that by using an ultrasound device, it was possible to expand the internal layer of fluorocarbon gas, subsequently rupturing the microbubble and releasing the compartmentalized peptide. Thus, target site specification is as easy as directing ultrasound wave towards any site, tissue, or organ in the body to accurately elicit the internalized peptide.
So by using these techniques, it is now possible to inject the patient systemically with a therapeutic protein, while gaining the specificity and intensity of an often far more invasive procedure. Plus, it's a lot less messy. The proceeding was brought to you by the Real Mackay Productions, a Kegan Mackay and Mitchell Ray collaboration.
The knowledge gained from this informative video is intended to inform and educate all individuals on the proper use of microbubble therapy. Any neurological or cognitive issues suffered as a direct result of the raw intensity of the aforementioned knowledge or due to the awesomeness factor displayed by both instructors is in no way a fault of or responsibility of either participant responsible for the making of this video. Upon completion of said video, the viewer hereby releases from liability and identifies all parties involved in its compilation.